Hi, I wanted to talk about an issue that pops up in hospice a lot that I've seen over and over again, and it has to do with the misconceptions of what hospice provides for the patients. So one of the most common things that people are shocked about as soon as they're admitted onto hospice is that they thought that hospice was going to be the patient's primary caregiver, and that in addition to that, they were going to be able to provide continuous care in the home. That, in fact, is not the case, where hospice is not the primary caregiver. In fact, we make sure that when we admit someone to hospice, there is an appointed person that will act as the primary caregiver for the patient. In other words, we don't tend to admit people onto hospice who are incapable of caring for themselves at home if there is no caregiver. And it doesn't mean that somebody has to live in the house with a patient. It just means that somebody has to be available to check and assist the patient on a daily basis if needed. And the second misconception, like I mentioned, is that people think that hospice is going to be giving continuous care for the patient, which means daily. And again, this is not the case. Hospice provides nursing care usually once or twice a week. They're scheduled visits, and sometimes it can exceed that number if it is something that is urgent or requested by the family for a specific reason that we deem is necessary. In addition to the nursing help, there's also medical aids that can go into the patient's home or nursing home, wherever the patient is, and assist them in minor nursing needs such as bathing. And to address the psychosocial and spiritual needs for the patient, we also have social workers in place and chaplains that have scheduled visits as well as potentially urgent visits that are deemed urgent by the caregiver as well as the chaplain at the time that the need arises. So despite all that, there are large gaps that remain outside of the hospice care. So why do those misconceptions happen? I know that hospice does educate the patient well in advance of hospice admission, and we educate them on what hospice can provide and what hospice cannot provide. So I think it has to do with the extreme stress that somebody's under when they are given a diagnosis or when they are told they are hospice appropriate. And the same goes for the patient themselves as well as their caregiver. It is a big shock to be told, oh, you are terminal now and you have a few months left to live, or a few weeks or a few days. And not only is it a shock for the patient, but for their family members and caregivers who have to go through their own process of grieving and dealing with the fears of what that means for them and the uncertainties that lie ahead. So when any of us undergo extreme stress, we don't hold on to information the same way. We don't process information the same way, and our memories are affected. So I totally understand why this happens and why, after spending an hour or two explaining what hospice is about and completing the intake process, why we have patients and family members so in shock. I totally understand that. I think what would help prevent that, or at least improve it, is have conversations and encourage conversations within our families as early as possible. Do not wait till the very last moment when we are on our deathbed, unless it's a tragic, traumatic death, something that could not have been foreseen or prevented. But yeah, for the most part, I think the earlier the conversations can take place, the better for everyone. So I think that's where the death doulas can come and fill in those pretty large gaps actually that exist, where the patients are alone for the most part, the majority of the day, and they may need more help than hospice can provide. They may also need more emotional support, more psychological support, spiritual support, and not just for the patient themselves, but for their loved ones and their caregivers. I'll make a separate video. This is getting kind of long, so I'll make a separate video as far as what death doulas can provide in the home and other places, and how that might be structured within each business. Thank you for listening.